So I'm going to first refer you to the fact that the US government issued a report in July on telecommunications, and the title of the report was that exposure and testing requirements for mobile phones should be reassessed. That's because ways of assessing phones have not changed since 1997 in the United States. And just a reminder of what we're talking about here in terms of the electromagnetic spectrum, cell phones are two-way microwave radios. That's the basic fact. Now you know that, of course, a microwave oven uses a similar frequency to a cell phone at 1,000 watts of power and can heat water. A cell phone uses much less than 1 watt of power. So the power is not the issue. Cell phones have very, very weak power. And we're not concerned about the power. We're concerned about other aspects of the signal, and particularly about the change in the power density over time. And I just want to show you here how much of a change there is from when you're on standby to when it's ringing, to when it's speaking, to when you're listening. And you see this tremendous change moving up and down here in the volts per meter. And it may be that it's the change and the rate of change that is more important than the power. So it's very different from the way we normally think about things in toxicology. Today I talked a little bit about the controlled experiments that have been done with human sperm. So the sperm issue is very important because these are data from sperm taken from human volunteers. And the exposed test tube and the unexposed test tube came from the same person. And they were exposed at levels that did not produce heat. That's important. So we know that heat is the main effect for which all the standards today have been set. So all the standards in the world prevent phones from heating the body, and that's a good thing. But the question of whether there are other biological effects besides heat, I think, has to be asked. And this evidence makes it clear that there are effects on sperm at levels that do not produce heat. And this is showing that the cell phone radiation exposed sperm, indicated here, die 3 times faster than those that are not exposed, taken from the same person. And this is showing a measure of damage to the mitochondrial DNA on the exposed sperm compared to control sperm. So there's 3 times more damage to the mitochondrial DNA of human sperm exposed to cell phone radiation. And this is a study from the Cleveland Clinic, Ashok Agarwal, of men who came to the clinic for treatment of problems of fertility. And he noticed that the men with the bigger problems tended to have more devices they were wearing on their bodies. And again, these phones do not produce heat because they can meet all of the standards which are based on avoiding heat. So without heat, he is showing an effect on reducing sperm count. And again, this is in human males. And there are other studies on this. Now, all of these are reviewed in this book that I've written. This is the English version of it. There is a copy in Finnish. It's called Patki in Finnish. I believe, Harry, you have a copy.
Patki.
Patki, all right. And this is the US cover. And we actually have, the big question is microwave radiation from mobile devices dangerous? And the answer is we don't know, but we have reasons for concern, and the reasons for concern lead us, at least in the United States, where Environmental Health Trust is working with the American Academy of Pediatrics. And the pediatricians have issued a letter to the government saying we have to rethink our approach to cell phones in light of the fact that standards were based on a huge man speaking for 6 minutes and then for 30 minutes, when in fact most people using phones today are using them for much more than 30 minutes and are not large men with large heads. This is an example of a very bad idea. This is a cell phone baby rattle case. It's designed to protect the phone from the baby. These are the fine print warnings that you can find on phones. Now this is my book, Reading the Fine Print as a Chapter. You can see that you cannot read that. And this is what the fine print warning says. The iPhone's SAR measurement may exceed the FCC exposure guidelines for body-worn operation if positioned less than 15 millimeters, 5/8 inch from the body, e.g. when carrying the iPhone in your pocket. So this is what comes with the phone that you can find in the fine print warning. Now, on terms of the brain cancer data, we have to be very clear that brain cancer takes a long time to develop in the population. And no increase was found in brain cancer after the bombs dropped toward the end of World War II, until 40 years later. That is, 40 years after the bombs dropped, there was a measured increase in brain cancer in the population. Brain cancer has a long latency in the general population. So the fact that we don't see an increase now is not proof of safety. It may be just a reflection of the fact that brain cancer can take a long time to develop. Most epidemiologic studies, as Dr. Albom has said, find no increase in risk. Most of these studies have defined a cell phone user as someone who makes 1 call a week for 6 months. And in the studies that have found an effect, heavy use consisted of half an hour a day, which is much less than what most people do today. In fact, when studies have looked at 10 years of heavier use, there is an increased risk of brain cancer. And I am a cancer epidemiologist. I have enormous respect for the work of this institute and for Dr. Albom. But I think it is premature to conclude that cell phones are safe because we don't see an increase in brain cancer yet. In fact, the Danish Cancer Society issued a report last week. Doubled brain cancer in the past decade. This is a quote from their report. The number of men who are diagnosed with the most malignant form of brain cancer, glioblastoma, has almost doubled over the past 10 years. We don't know why. It could be a number of things, but it obviously is sufficiently important that the Danish Cancer Society issued this report. And these are data that my young colleague and I just presented to the American Public Health Association. These are showing the annual percent change in glioma in the United States in people under the age of 40 over this 30-year period of time, 1990 to 2010. And you can see that in the age group 20 to 29 and 30 to 39 and 40 to 49, there is an annual increase in glioma of between 1 to more than 3% annual increase. Now, this could be due to increased use of computerized tomographic scans of the brain. This could be due to other things. But there is an increase in brain cancer now in the United States that we have just reported. There is an increase in brain cancer in Denmark, and there have been reports that the Swedish data, in which you see no increase, may have reporting delays in the data themselves. We don't know what's going on here, but we do know that cell phones can damage sperm, can reduce sperm count, and I've showed other biological effects as well. These are data now taken from Niels Kuster's group, showing that there is fetal exposure to cell phone radiation, and the exposure is greater when the baby is bigger because there's more baby and less fluid. These are just some of the warnings that come with the BlackBerry. It says keep it 7.8 inches from the pacemaker when the BlackBerry is turned on. Do not carry it in your breast pocket. Very few people are aware of this. This is the campaign that we are working on with Radiation Research Trust. These, about 40,000 of these have appeared in what are called urinals in London. The sign is quite simple. Your future is in your hands. Medical experts are warning men not to keep mobile phones in their pockets, as this can have a direct effect on their fertility. Happy to answer any questions you may have. Thanks.
Okay. Thank you, Devra. Any questions, kysymyksiä?
Why do you think that it doesn't show in the Finnish?
Sorry?
Why do you think that it doesn't show in the Finnish, for instance, Finnish cancer?
Well, actually, there is, first of all, Finland's a small country, and there is recently a suggestion of a slight increase, but I have not looked at those data in great detail, so I don't know the answer. But the percent of the population using cell phones today is very high. But the percent of the population using cell phones 30 years ago, I don't think was as high. And it certainly has been more cell phone use in Finland earlier than in the United States. So I don't know. I mean, what we can say from trend analyses is simply we have a trend. We cannot tell you what it's due to. In the beginning, when the trend was first reported in lung cancer, and people said maybe it's due to smoking, the answer was we can't be sure what it's due to. But we need to start to ask those questions. Right?
Have you done any personal changes in your own life?
Well, yes, of course, including especially for my grandchildren, which I'm most concerned about. When I use a phone, I use it with a headset or a speakerphone. And we have advice. Do you have the copies in Finnish?
Yes.
This is the advice that we give people about. Okay. The way it's supposed to go is right. It didn't work on this paper. It goes like this. But you can fold it like this. All right, and then they can see it. Yeah. All right. This tells you the absorption into the brain of a child. All right. And this shows you the chemistry alteration that occurs after 50 minutes of a phone, the reduction in sperm count. It mentions that the World Health Organization has concluded that cell phone radiation is a possible human carcinogen. Were you aware of that? That the World Health Organization had a group of experts that met and over a period of time reviewed all the literature on this issue. Is that something that's known here in Finland?
Oh, yes.
Okay, and that the World Health Organization concluded that cell phone radiation was in the same category as diesel engine exhaust, DDT, and lead.
And coffee.
No, not coffee, caffeic acid. Coffee, actually, caffeic acid is in fact a carcinogen. And there are many things that are carcinogens at one level and not at others. But the point is that DDT, lead, and engine exhaust are substances for which most governments have taken regulatory action. Cell phone radiation is, at this point, is becoming the subject of action in some countries like France and Israel. And the back tells you what to do about it.
I had the honor of working with this program in Lyon for 25 years, and I've seen quite many evaluations done. Ethanol is in group 1, which is a human carcinogen, but
Right.
not much is being done. I mean,
Right.
10 liters pure ethanol per person in Finland today.
Ethanol is alcohol that we drink,
Yeah.
right? And so,
So I think it's just dangerous to compare the carcinogenicity in using the categories, because they are not categorized according to the potential impact, but they are categorized according to the available evidence.
Right.
So that makes a difference. That's why I think that it's impossible. It's difficult to compare, saying that if an exposure A is in the same category as exposure B, it doesn't mean that it has the similar public sort of health consequences,
Right.
because they are maybe completely different cases.
sure.
But what Devra was saying, that's true, that it's a possible human carcinogen as evaluated by IARC, which is the International Agency for Research on Cancer.
And that should be taken quite seriously, and because of that, we recommend that you take these 6 steps to reduce your direct exposure. And this recommendation of Environmental Health Trust to reduce your exposure is the same recommendation that appears on the Israeli government website now from the Health Ministry of Israel, and also from the Health Ministry in Canada. So many health departments in many countries are saying that you should use a speakerphone, use a headset, avoid using a phone in areas where signal is weak, because when signal is weak, your phone will drain the battery, and because we have symmetrical antennas in our phones, half of that radiation gets into you. And we think it's a good idea to avoid it, not because we know for sure that it's harmful, but because the evidence is suggesting it is, including the fact that the World Health Organization has called it a possible human carcinogen.
Onko suomalaisille vastaavia suosituksia annettu? Voitaisiko nämä painaa?
Ehkä voitaisiin sitä kysymys kääntää professori Kari Jokelalle, joka on STUKin valvontaviranomainen näissä asioissa, niin ehkä Kari voi vastata.
Joo, kyllä ensinnäkin minun mielestäni ei ole minkäänlaista vakuuttavaa todistetta siitä, että kännyköiden olisi karsinogeenia tai siitä olisi mitään niin terveydellistä haittaa aikuisille tai lapsille. Mutta toisinpäinkään emme voi koskaan sanoa, se on tieteellisen tiedon perusfaktaan, että jotain asiaa ei voida koskaan tieteen avulla todistaa niin olemattomaksi. Ja koska niin väestössä on jo jonkin aikaa, aika pitkäkin aikaan ollut esiintynyt pelkoja ja epäluuloakin kännyköiden radioaaltoja ja muitakin sähkömagneettisia kenttiä kohtaan, niin tietyissä tapauksissa on niin sanotaan, yleisesti ottaen järkevää ja jonkinlaisia sanotaan, niin kuin lainausmerkissä varovaisuusneuvoja antaa. Ja lasten kännykän käytössä säteilyturvakeskuksella on tiettyjä sanotaan niin suhteellisen lieviä, mutta tiettyjä neuvoja rajoittaa lasten kännykkäaltistumista varmuuden vuoksi ilman, että siitä tiedetään olevan sinänsä mitään suoraa somaattista haittaa tai sitten tätä suoraa haittaa meidän soluillemme.
Voitko toistaa, mitkä ne on ne varovaiset suositukset?
No meidän ihan suoraan helposti menemällä niin nettisivuilla löytyy niin sanakäänteet, mutta että ajatus on juuri se, minkä sanoin, että tällaista en halua antaa mitään tarkkoja neuvoja siitä, kuinka paljon saa käyttää. Joskus meille tulee, silloin tällöin vanhemmat kysyvät, että antakaa nyt viranomaisen niin määrä lapsille niin rajoittaa kännykän käyttöä. Sanomme, että kyllä se on niin vanhempien asia ihan 100%, mutta kyllä tietysti tällaista niin kuin, sanotaan niin kuin terveellä maalaisjärjellä voi sanoa, että tekstarin lähettäminen ei altista meille tätä meidän niin kuin tärkeintä niin kuin elintämme, eli aivoja, tai siis paljon vähemmän altistaa. Se on niin kuin ihan perustuen siihen, että tämä altistuminen vähenee radikaalisti, niin neuvo on niin kuin esimerkki tällaista neuvosta on annettu. Ja tietysti sitten se, että tämmöisessä heikossa kentässä niin kuin puhumista, jos mahdollista välttää, koska silloin kännykän teho säätyy niin kuin korkeammalle. Ja se on vain pienikin etäisyys päästä vähentää altistumista. Mutta kaikki nämä niin perustuu niin siihen, että altistuminen vähenee, mutta meillä ei ole niin vähintäkään niin tietoa siitä, että väheneekö mahdollinen haitta sikäli kun sitä onkaan.
Ymmärsinkö oikein, että aivokasvaimet ei siis ole Suomessa lisääntyneet?
So the question was what's the situation with the brain cancer in Finland if you look for the trend? So
I think it's very similar to the Swedish register. Very similar as in Sweden.
Well, actually, no, I have some data showing a slight increase. I have it on my...
The Finnish?
No, yes, in Finland.
Okay.
Yeah.
You can...
Yeah, I will show it to you. But the fact is, we don't want to make too much of trends one way or the other.
Yeah.
You know, I think the important issue, just as Stuk has said, is that it's a good idea to restrict children's use of mobile phones. When we developed this pamphlet, the first thing I did was to say, Stuk has given this advice 2002, 2006, 2008. You've done this many times. And I think it's good that you've done this. Is there a program to distribute this more broadly? For example, this is from your website now, right? So is there an effort to distribute this to children in schools or to their parents?
I think that it's sufficient to have it in our website. We also are now having negotiations with our Nordic colleagues for a common statement on this issue. In fact, we have an older statement, but we are going to revise the older statement. But let me say that there are no changes in how to say. We still continue this very mild recommendation for children, but we do not see any reason to give stricter advice to people.
All right, but the advice is to recommend that children text message rather than mobile phone calls, and not to use phones in weak fields. And so we took our advice from your advice, right? So.
Well, this is only based on the idea that we can, by this simple means, reduce our exposure. We do not have any idea whether it has not any effect on the adverse health impact.
And if we're going to be very... Yes.
Muita, is there any other questions? Yes, please.
Yes, maybe I misunderstood, but do you, at least in some way, disagree perhaps about the possible dangers of it? I got the impression that Professor Davis was a bit more concerned than Mr. Albom.
Well, I don't know if I'm more concerned than Dr. Albom. I'm concerned.
Okay.
Yes, I am concerned. And I'm concerned based on the data on damage to sperm and data that I showed today that I've written about in my book on effects on DNA repair. And I've shown that if you take brain cells, if you take human brain cells and animal brain cells, and you take stem cells and you expose them to cell phone radiation, that you can damage their ability to repair themselves. So you affect DNA damage, repair. Normally, if you have damage to DNA, it gets repaired. And what cell phone radiation can do is it can significantly reduce your ability to repair damage. And for that reason, I am concerned. And that concern is something I share with the Israeli government health ministry, labor and environment ministry, which has issued advice quite similar based on the fact that there is experimental evidence of this damage. I also earlier today showed evidence that prenatal exposure to animals, to mice, rabbits, and rats, produces offspring that have smaller brains and more damage to their brain cells. And so for me, that is a reason for concern. And then if I link it to the human studies that have been done, and there aren't many human studies, there are not, but the human studies that have been done, one in particular that actually measured exposure to electromagnetic fields during pregnancy and then looked at the health of the children 13 years later, found a significant increase in obesity and asthma in the children whose mothers had greater exposure. So yes, I am concerned, and that's why I'm here.
Okay. Professor Albom, do you agree to disagree?
Well, I don't think this is a place for a discussion between us. Really, I try to explain that I think it's important to continue to monitor the information that we have. And when I look at the data, I really see no real signs or effects yet.
Well, have you looked at the data on neuronal chemistry, on brain cell effects?
Perhaps this is not the time to go into the detailed arguments here. I mean, if I may sort of seen from a distance the presentations, Professor Albom gave the sort of evidence-based evaluation of the current epidemiology on cancer, and that's based on the normal standard procedures, the way you do evidence-based evaluations for medical sciences. And Dr. Devra Davis used all the evidence also from the experimental studies and in vitro studies, and finding out signs which are of concern, but which do not prove that something is taking place in humans. But it's just saying there is a possibility for an effect if this is also happening in humans, and under the exposure circumstances which the humans are exposed to. And I think that this is a valid point. Also, what Dr. Davis didn't mention really was that some of these sort of electric fields are being used nowadays in cancer treatment, which is quite interesting because you have a sort of you take a hat which creates this electric field, and it has been used in the treatment of brain cancer and also some other cancer types like cancer of the liver and cancer of the lung. But these are fairly isolated cases at the moment, but seems to be a very promising method for therapeutic medical oncology for treatment. And of course the idea here is that if you can prevent the rapidly dividing cells from dividing, there is a possibility, at least theoretically, a possibility that lower exposures may interfere with the cellular division even at smaller doses, at lower concentration or lower exposure levels. But the evidence for this is far from being complete at the moment. So I would say that the apparent discrepancy between the two presentations here is because of due to the different way of looking into the data. I hope that.
I thank you for that clarification. I had forgotten. The Food and Drug Administration in the United States approves certain therapies for treatment of cancer, and they do that based on evidence. And they looked at the evidence on the use of electrical fields to treat cancer and have approved it for that use. So it's at the same level as a pharmaceutical approved treatment, and it's now available commercially. It's called novocure.com.
And it was proved exceptionally based on very little evidence because the evidence was so dramatic.
Yes, dramatic because people who were going to die didn't.
Kari Jokelas, and then I think if you don't have any questions, you can think about questions now, and if you do have questions, we can continue, but if not, then we finish with this press conference. Kari Jokelas, please.
Thank you. On only one comment on that rather interesting issue on the cancer healing. I'm not an oncologist, but let me stress a very important thing. There are some indication and some evidence that a relatively low frequency electromagnetic fields. As an engineer, I speak in the terms of hertz, 100 kilohertz, 200 kilohertz. It seems to possible that the currents generated at these relatively low frequencies may indeed have some effect on cancer healing at the level which are clearly above the present exposure limits. But my main point is that it's very important to distinguish effects of heating radio frequency radiation like that coming from mobile phones to the effects of lower frequencies. They are fundamentally different. That's why we cannot make any conclusions on the significance of mobile phones on the cancer development, healing, or creating cancer from those kind of studies of clinical studies of healing properties of relatively low frequency electromagnetic fields or currents.